I'm Reed Alexander for Retreat Behavioral Health. Thank you very much for joining us on YouTube, on our website, and social media platforms. Good to see everybody here on this latest edition of Headspace. Today, we're joined by a psychiatrist who's our medical director at Retreat at South Connecticut, our site in New Haven, Connecticut, Dr. Roger Ayres. He's here to help us break down some challenging topics around the question of how we can continue carrying on with life as whether it maybe not be what we used to know, but certainly what it will look like in the months and potentially the years ahead after the tumult of the pandemic. Dr. Ayres, great to see you. Thanks for joining us.
Thanks for having me.
Yeah, it's a pleasure. We appreciate your time. This has been a stressful few months for people all across the country, all across the world. We have seen lockdowns. We've seen severe restrictions on our movement, on the ability to do business. We've had to really reframe our thinking around being in close proximity with people. And this hasn't been short term. I mean, you recall, as I recall, earlier this year in March when we first heard about the coronavirus and it was spreading in the US, I think a lot of us were thinking maybe this would be 2 weeks, then it was a month, maybe 2 months. It's now been 7 months. And I think many of us have come to the understanding that, the way we've been living could very well spill over into 2021. So prolonged periods of stress and trauma, how does that impact the brain or retrain the brain when those periods drag on for months and months on end and in effect they become your new normal?
Right, so that's a great question. I think for starters, stress is certainly cumulative in the sense that it can add up over time. So for a lot of people, it's when they're stressed, it's not just any one thing. Most of the time, of course, if it's a big thing, then of course you feel a lot of stress from that one big thing. But it's sort of a multitude of various things over time that can really, really add up. And then when that's in the context of, say, poor coping skills or somebody that already has a predisposition to potentially any kind of mental illness, then it can really cause problems for people. We're naturally social creatures for most people, are wired that way. And we are looking to connect with people. Instinctually, we are like neurons. Neurons want to connect with other neurons, and humans in general want to connect with other humans. So now we've had this prolonged period where I think, people haven't been able to connect, and the connections that have been made, from what I've been, the feedback I've gotten haven't been in the way that they've wanted to. Of course, people have found workarounds like Zoom and things like that.
Sure.
But on the other hand, it for many, it hasn't sort of hit the spot in the way that they would like to communicate and connect with other humans. So that's been stressful for many, and I think it has retrained their brains to sort of find a way to exist a little bit more isolated. Of course, some people, it's more isolated than others. I think this kind of goes case by case. But back to the idea of finding, or at least trying to find, healthy workarounds as we now have learned more about the virus, is what I'm starting to slowly see as far as trying to connect as best as we can given the circumstances.
Sure. People are having to find creative ways to obviously collaborate and work together for prolonged periods, not short-term periods, but also find some degree of meaningful social interaction. We've not lived through a pandemic like this in our lifetimes. It's not the first time this has happened on planet Earth, but we have lived through periods of severe stress and trauma and anxiety and pain. So I wonder if you can think of any historical antecedents that would have had as great an impact on the human psyche, or the way that it kind of impacted how we lived for a certain period of time in the recent past. Can you think of anything that would be akin to the magnitude of what we've been seeing?
I mean, for me, I think what really jumps out at me and comes to mind is 9/11. Of course, it's hard to make a one-for-one comparison, but there's certainly some similarities. I think our sense of security now has changed just because of the virus. But then if we look back at 9/11, I think our sense of security had also altered. Because after 9/11, I think that's when, we were more concerned about terrorism, both foreign and domestic, to the point where, the screenings changes at the airports. But now we have our own COVID screenings now. So I'm drawing the analogy. And there was just a sense of uneasiness, and not knowing, how this would play out, because this huge event had occurred. And then the other thing that I find very analogous is, of course, the whole country has been affected, but I think initially, I think this tri-state area was more deeply affected with both 9/11 and now with COVID. So I find this 9/11 situation to be quite interesting and quite analogous to what we're going through now. Of course, it's not one-to-one, but I have pointed out, I think, some similarities between these two events.
Yeah, no, I think that makes sense. And certainly the virus spread, earliest and most aggressively in the most populous city centers, densest city centers, which also fueled the fact that New York was the financial capital of the world back in 2001 and made it such a target. So the Northeast and the tri-state area, I think you accurately point out, have experienced some of the first shocks and traumas of these two crises. And the rest of the country is, in many cases, in many states now, just catching up and feeling some of the really terrible effects of the coronavirus. We've talked about how long this has dragged on, but, we're obviously in behavioral health at Retreat. We see people who come in with heightened levels of anxiety, co-occurring disorders, substance use and misuse. So what are the long-term side effects that we should be looking out for in the year ahead? And as sociologists look back in time, and epidemiologists, and do research on the effects of addiction or mental health maladies and disorders that would have resulted from this time, what do you think they're going to be looking back on? Heightened levels of anxiety, or what else might we be seeing?
Exactly. I think that's, the sort of the, unfortunately, the usual suspects are going to be, in my opinion, something like depression, anxiety. And then if we look maybe a little bit deeper, I think for some people, potentially PTSD, post-traumatic stress disorder. So I think, it's, anything usually not dealt with for a prolonged period of time usually devolves into depression. So with that understanding, I think those three things are things that you would see. Over time, stress tends to go to the weakest point of the body. And for some people, that's their brains, either because they have neglected their mental health or they have predispositions. Sometimes it's pain from car accidents or whatnot, and it really goes and travels to the weakest point of the body. So that long-term thing can really, really be concerning. So I think, to identify these people is going to be really important, whether it's, self-referrals or through EAP programs, or family members. And I think the idea here is just promoting self-care and wellness through all of it. Obviously things like hobbies, relaxation, we talked earlier about, social gatherings, but safe social gatherings, of course, given our current situation,
Right.
exercise, meditation, just any kind of psychosocial support. But I think the self-care and whatever any individual needs to really take care of themselves at a time like this is really important. And of course, since I mentioned things like depression, anxiety, and PTSD, then that opens the door for professional help, which, would be something like a psychiatrist or a therapist or whatever's needed given any individual's situation.
Now, people have responded to this with a spectrum of reactions and emotions. Some people have really adopted caution. Some people have taken more risk. Some people have embraced wearing masks. Some haven't. Certainly I'm not interested in what's right and what's wrong, but I am interested in why people respond to these sort of unifying widespread traumas differently. Like the coronavirus, doesn't selectively choose whom to infect. It affects everyone, has the potential to infect anyone. But obviously people modulate their responses accordingly. Is it normal when we see such severe trauma like this to see such a spread and spectrum of people who, in some cases, want to stay home, in some cases, are eager to go back to the office, in some cases, are deploying all measures of caution, and in others, are really, really keen to return to life as they knew it? Is that normal?
So I think there's two things to think about here. I think the first and foremost thing to think about is the leadership. I think that certainly, we've kind of had a different response geographically to the virus. So there's been, different states have kind of done things a little bit differently. Some states have kind of treated the virus and the precautions a little bit differently than others. And so I think that really sets the tone for how different people have responded differently. And then furthermore, from what I can see, I think each individual response, at least in the very beginning, tended to be in one of three camps. I think you had people that were very, very scared, and they would take extreme precautions, and then you have people that didn't necessarily take any precautions, and they had a very opposite response to the virus, and didn't do much to be safe. And then sort of you had this gray area, and I'm seeing over time now that 6 months into this, I think people have moved around. That gray area has really started to define itself. And now it comes, for a lot of people, it's their own level of risk tolerance and what they want to take, with the backdrop being what each geographic region has set as far as the policy on when they can open. Many states have adopted like a phase response: phase 1, phase 2, phase 3. So a lot of states kind of have to adhere to that. So there's only so much room an individual has in the backdrop of what's being done on that larger on a larger scale policy kind of a thing. So I think that's really why you're seeing very different responses to something like this.
People have, been really up in arms when they see others who respond differently to this than they do. So how do we calm some of those tensions? How do we get people to a place where they can maybe politely disagree, but do what's best for them? How can we bring, I guess, a sense of civility and calm down a lot of the really strong feelings we're seeing on the opposite ends of the spectrum among the kinds of people you were describing, those who took really serious and maybe continual precautions they may still be taking, and those who were less cautious? How do we do that?
So I think one thought is that there's only so much that can be controlled, and you really can't control other people. So I think this comes down to each individual to control their own situation, and the precautions that they're going to take, because you really can't enforce at the individual level someone else to do something. So it really comes down to you identifying what a risky situation might be, the precautions that you want to take, whether it be social distancing, wearing a mask, the hand washing, all of that. You're carrying around hand sanitizer, all of the above, because you may or may not see other people doing that, but you can certainly take control of you yourself doing that. So I think that's probably the biggest piece. The other piece that I will invoke Dr. Fauci, who is our national infectious disease expert,
Mm-hmm.
who I respect very much. And I think he made a comment that really resonates with me, that really, I think, is a good answer to your question. And he reminded us that the coronavirus is really the enemy here, not each other or not either side. And to kind of be mindful of that. And I think, that just trying to remember that we have one common goal here, that there's only one enemy, and it's the virus, and it's not us against each other.
Mm-hmm, mm-hmm. I think that's very profound. So the last question I'm going to leave this on is this question about, what happens next? We are in an uncertain phase. We're awaiting a potential vaccine, hopeful that that treatment may come. We're certainly waiting for a looming winter wave, which experts have warned is potentially brewing now that we're in October and we may see a surge in cases. So people need to continue to be smart about this and be on alert. We are by no means through this. But when that day ultimately comes, when people deem that it's safe to gather again, whether we've been immunized or whether something else has happened that's made it safe for us to return to some semblance of a more active and vigorous life than we're told that we should be living now, there are going to be people who will continue to be on high alert even long after this is over. I think it would be folly to think that we're going to flip a switch and suddenly it's safe to go back out and everyone will be fine. I mean, this has really impacted our thoughts around physical proximity to people, being in an office, being in a school. So what would you say to those people about the potential for reentry, not from a medical perspective? I'm not asking you, to tell us, how long we have to wear a mask. Obviously, nobody knows that answer. But from a mental health and cognitive perspective, how can they start to reconcile with some of those anxieties so that when the time comes to reemerge back into the world safely, that they can do so comfortably and with confidence and not prohibited by deep and entrenched fears that have mounted over these past many months?
Right. So I think the idea here is to understand that there will be some amount of apprehension, but to your point, to kind of lessen the intensity of the fears is once again to try to take control of what you can take control of. I do think that one thing that I have noticed is that many employers that want their employees to come back to work or plan on having employees come back to work have done some kind of research into what that would look like.
Mhm.
So I know it's a little bit of blind faith and you won't know until you know, but it seems as though many employers um, are starting to look into what that would look like to make the workplace a safe environment, whether it's, hand sanitizing stations, whether it's, temperature taking right at the door via AI technology. That's something that I've heard a company think about and talk about. Whether it's, spacing, the offices and the workspaces further apart, plexiglass. I think obviously every company has its nuances of how they can work, but I think that um, you know to kind of see how the employers are going to have it set up, or to inquire or to be in contact with your employer to know what's going to happen could ease a little bit, uh, if you were to know the kind of precautions that were going to be taken once you re-enter. And then again, at the individual level, I'm pretty sure no employer will object to the hand sanitizing and the mask wearing and the social distancing. So again, taking control of that. And then, avoiding any kind of unnecessary risk. So then, if you're still not feeling comfortable, then to open a dialogue, either, with either, human resources or potentially going to your EAP if you need help, kind of navigating it because of the apprehension that you have and the anxieties that you have. And then the last thing, self-care, self-care, self-care is really something to think about and to really employ at a time like this now, and especially when you reintegrate, as far as, healthy coping mechanisms, professional help if you need it, just to kind of prevent anything before it spirals out of control, would be a suggestion.
That's good advice. Dr. Ayres, thank you. It was nice to see you today. I appreciate your time on, I know what is a complicated subject, but affects really all of us. So thank you so much for taking the time out.
Thank you.
And of course, if you want to get more information like this, you can find us on our website, retreatbehavioralhealth.com. We've got plenty of resources, and reach out to us directly so that we can help answer your questions. Thanks for watching. For now, we'll see you next time on YouTube, our website, and social media channels. I'm Reed Alexander for Retreat. Bye for now.